people. I bow down for everyone. My time.
I am who I am because I am who I am. I am who I am, take it or fucking leave it. But I put in the motherfucking work.
Hey, what's up, YouTube? Back with another video, and today you already know a bitch is back from a little heartbreak or whatever, but you already know a bad bitch can't be down forever. So today we finna be, doing a little day in the life. I'm finna be basically going to the, what's the place called? Hormone therapy. First, I'm going to the weed dispensary. Then I'm going to the hormone therapy place to basically kind of just talk to the people, check my estrogen levels, make sure it's not too high. I have been taking a break from taking estrogen, but it's really only been 1 week since I've been taking it. If you are first now tuning in and stuff like that, I've been taking hormones for 1 year and 4 months. And that's the tea. But yeah, I've been on hormones for 1 year and 4 months. It's only been 1 week. I haven't been taking it, but today I'm gonna be just trying to make sure that I'm in the clear to start taking my estrogen again. And then soon I'm going to be getting a little bottom surgery. So yeah, stay tuned for that. And then after I go to that place, then I'm basically going to be going to the nail salon to basically get my nails done. So yeah. Y'all want to see some boots that I got? Hold up. So I had got these boots, period. Every time I walk, they be complimenting me. And I be like, man, go ahead. I don't even got that shit on, bitch. Move. But yeah, that's the tea. So with no further ado, let's get into the video. Let's get into the little vlog or whatever. Get into the braids. You already know it's tea. Get into the tag. Mwah. But yeah, so still kind of sad. Still kind of sore from the pneumonia. Dude almost killed me. But that's just my sign to never date again. So yeah, get into the little doggy bag or whatever. Because bitch, I'm in my bag, huh? But yeah, that's the tea. Get into it. And that's it. This is the best stuff that they have. Can I get some indica? Or whatever.
But you shouldn't, that's not something that you should have to deal with. Okay. Alright. So you weren't having any symptoms or side effects or anything, is that right?
Recently, I think I did.
Like, what were you having?
I had a really bad headache.
No. I mean, like your moods weren't all over the place. You weren't having injections and reactions at the injection site.
No, I wasn't having reactions at the injection site. And when it comes to the mood, I really wouldn't know because before I started taking hormones, I've been emotional. So
yeah, because you weren't living your true life. And now that you are, I'm sure you're probably a little bit more steady. Okay, babe. So here's the deal. Are you on Spiro or any blocker or no?
I don't really like taking them.
What?
The Spiral.
Why?
Cause that's what really makes me emotional. That be messing with my mind.
Say that one more time.
The Spiral, it be making me all over the place. My emotions, my emotions be up and down and.
Oh no, honey, I think that's the estrogen.
You sure?
Spiro doesn't do that.
You sure?
Yeah. So basically, the spironolactone is blocking your testosterone, right? So meaning, your body is still producing some testosterone. The Spiro is kind of tamping it down, making it so that it's not as high as it naturally would be. And the reason that's important is because.
Also, when it mixed with the estrogen.
So if you just give estrogen, it'll still work, and you'll still see some changes. You might see some breast growth and some hair softening, skin softening. You might notice some fat redistribution. You might get a little hippie. But what the Spiro does is, so when you put just the estrogen in, your body responds by increasing the testosterone production for a little bit to kind of combat it. And so the Spiro keeps the testosterone down, so the estrogen can be the kind of like the dominant hormone, and that's what allows you to kind of like get all the changes. So the Spiro, it's not the Spiro that's causing any emotional ups and downs. Now it could theoretically be the estradiol, because when you inject estradiol, right, your levels of estrogen go straight up, and then they slowly start to come down, right? And so some people, when it gets close to the time for their new shot, their hormone levels are so low that they feel just kind of moody and out of place. You know what I mean? So that might mean a couple of things. It actually might mean that your dose was too low, right? That you were only doing like the 0.2 or the 0.1. It could mean your dose was too low, or it means that your body uses it so quickly that we need to dose you weekly as opposed to every other week.
Okay.
Does that make sense, what I just said? If it doesn't, ask me questions.
I think it's making sense.
Okay. I can explain it in more detail if you want, or in less detail.
You can explain that a little bit more.
Okay, so so basically all our bodies are it's always trying to stay balanced, right?
Mm-hmm.
And so your body has a level of like testosterone that it likes to be at, and a level of estrogen it likes to be at. Okay, because both. It doesn't matter what
I
your
got a
sex
question.
is. Huh?
Because I'm pretty sure by now my testosterone level is like suppressed, or like,
We can see. Like when we draw blood today, we'll see.
so like, let's say it's like really, really low, my testosterone level.
Uh-huh.
And basically, every time I take the estrogen, would that like improve my mood?
Theoretically, yes.
But then I guess when it gets to the point where like I'm finna take like a new shot, and let's say my body is actually like, like what you say is like taking in the estrogen like really fast. So
Possibly. I mean, I don't know. I can't really, without seeing labs and seeing where your levels are, I can't really speak to that. I'm just saying that your moods, if they're doing this, that's not going to be the Spiro. That's going to be the estradiol.
okay, because I haven't been taking Spiralaxone.
Okay. Well, here, let's see. Well, you know what we should do? Why don't we see where your testosterone levels are at? So when we
Okay.
draw the blood today, we'll see where the levels are at, and if they're good, great. Or like by good, I mean if they're like low, like suppressed, like we want them, awesome. If they're still a little bit high, we might want to put you on a little bit, just a little bit of Spiro for a little bit to keep it down, and then eventually it'll stay suppressed just with the estrogen alone, and you won't need the Spiro.
Okay.
Okay. So we'll see. We'll see where your levels are at.
Okay.
And again, the thing I have to emphasize is that this is all kind of a choose your own adventure. There's no real right or wrong way to do this. It's whatever you feel comfortable with. So even if, let's say, your testosterone levels are still up and you're like, I really just don't want Spiro, you don't have to take it. We could just go with the estradiol and work with that. Okay? All right. So, okay. So, right. Have you ever had any gender affirming procedures?
That's actually what I wanted to talk to you about too, because recently I was
No, we'll get there, baby. Have you ever had any done?
No.
None. Okay. Now, and I think this is probably where you're getting at with that. Do you have interest in some in the future?
Yeah.
Okay. So what, in your in your dream world, what would you like to have had done?
Orchiectomy.
Okay.
Like I recently was supposed to get one, but I didn't have a mental health letter.
What, honey?
I was supposed to get one. Like I've been currently talking to a doctor.
Where?
In the Bronx.
Okay.
And they were supposed to do the procedure, and everything was good, and I turned in all of my letters, but the only letter that I don't have is the mental health letter.
Okay.
So it's just like.
So we can connect you with behavioral health here. It's not a problem. Okay. So orchiectomy. What else, if anything?
That's it.
Like body contouring, FFS, tracheal shave, bottom surgery, breast augmentation. Just.
I was gonna get a breast augmentation, but I think I'm kind of just exploring.
The reality is you've only been on hormones for a year, and it usually takes about depending, like 2 to 4 years to see the maximum changes that the estrogen will bring about. So waiting until you see like what your body will develop is perfectly like fine. So if you just want to see like what your like the kind of breasts that you'll develop just by going through this like new form of puberty, that's perfectly acceptable. But we could discuss doing a breast aug later if you get to a point where you're just like it's not getting any bigger and you really would like your breast to be larger.
Okay.
So no FFS, body contouring, nothing like that.
No, not really.
Okay. And you.
I actually wanted to I wanted like what is that called? Like the hip.
Body contouring.
Yeah.
Yeah.
Something like that.
All right.
I don't know if it was called like a
They call it BBL.
Yeah.
Yeah, but that's the street name for it, a Brazilian butt lift. But we call it body contouring because that's how we get insurance companies to pay for it.
Yeah.
Okay, so orchiectomy and body contouring. Now, is the orchiectomy in anticipation of getting doing bottom surgery?
Not. It might be. I don't know, cause like.
The reason is, if I remember correctly, and this is why I'm asking this, is that when they do the bottom surgery, I believe they use some of the skin, like from the scrotum, to make the labia.
Mm-hmm.
So, if you do the orchiectomy first, they wouldn't have the skin to make the labial folds. So that's just something to think about.
I think the doctor actually told me that like they're not going to take the extra skin off.
Oh, they'll just remove the testicles?
Yeah.
Oh, all right. Well, great. Good for them. Perfect.
Yeah.
Okay. So, all right. Now, let's just talk real quick about your hormones. So, obviously, we're going to get all of your labs today. We'll see where your hormone levels are. When was the last time you had a shot?
2 weeks ago.
Okay. Last estradiol injection 2 weeks ago. Okay, great. So I guess the question is how, like, it seems like you're ready to fully transition. Is that a fair statement?
Mm-hmm.
Okay. So then what we could do, because right now you're on a very, very low dose of estradiol, okay? Would you like to go on like the standard dose that we usually recommend for our patients who are like really ready to transition?
Yeah.
Okay, so because that's 0.5, okay? So that's what we could, it's like considered the highest dose of estradiol. It's 20 milligrams. So in the vial, it says the vial has 40 milligrams. And so it's 20 milligrams every 2 weeks. So that's half, like I said, 0.5. So we could do that if you're really ready, but you'll start seeing like the changes, the body changes a lot faster with that kind of dose.
Okay.
Is that something you want, or do you want to stick with the 8, or do you want to go back to the 10? Bear in mind, like, you're not locking yourself. You're not locking yourself in anything. We can switch this around as needed. So here, so you were doing 0.1. That's because you didn't have primary. You went to doing 0.2. You were doing 0.2. Okay.
Mm-hmm.
I'm saying that the standard dose is 0.5. Like when we're starting on, so if someone's ready to transition, like if someone comes to me and they're just like, I'm not really sure. I think that I want to transition, but I'm not sure. We probably wouldn't start them at the 0.5. We'd probably start them a little bit lower at like a 0.1 or a 0.2, if not just starting them on pills, right?
Mm-hmm.
But if you're fully ready, then you would do the 0.5. That's the standard like transition dose.
Okay.
Yeah? All right.
And I would be like every 2 weeks.
Uh-huh.
Okay.
Now, who taught you how to inject?
I guess my doctor in New Orleans.
You guess?
Yeah.
What do you mean you guess?
Because I still had to watch a video.
You what?
I still had to watch a video when I went home.
Oh, okay. But you feel comfortable doing the injections?
Yeah, I've been doing it for like a year.
Okay. All right. Let me.
I just didn't know that they like it goes that high to like 0.5.
Yeah. What?
I just didn't know it goes that high to like 0.5.
Oh yeah. actually. Hold on. All right. And have you? Sorry, give me 1 second, sweetheart. I just gotta get all this stuff ordered for you. That. Do you have insurance, sweetheart?
Mm-hmm.
What kind of insurance do you have?
I have Medicaid and Medicare.
You have what?
Medicaid and Medicare.
You have a Medicare. Excellent. Did they take that information up front?
Yeah.
Okay, good. All right, so let's do this. Okay, boop, 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 boop. Okay, so I'm ordering that. Okay. Okay, medication management. You said Biktarvy, right, sweetheart?
Mm-hmm.
Okay.
And once I take the, once like eventually I do like get the orchiectomy, like would it still be 0.5?
What?
Like once I get the surgery, like would it still be like 0.5?
Well, again, it can be, but we can also reduce you.
Mm-hmm.
Like, remember, like I said, this is a choose your own adventure. If you're like, if you do 0.5 for, let's say, a month, and you're like, I don't like this, it's something about it just doesn't feel right to you, then we reduce it. If you are doing 0.5 and you get the orchiectomy, and you're still feeling good with 0.5 after the orchiectomy, we'll stick with the 0.5 for now. If you want to reduce it, you reduce it.
Okay, I get it.
Like, I mean, you know, there's no, like I said, there's no real, like, sorry, I was going to say there's no right or wrong, but, like, there are wrong ways to do this. Like, we're not going to go above 0.5,
Mm-hmm.
okay, but we can play with it, bringing it down a little bit if you want.
Okay.
And also remember, like, you know, what the estrogen is doing, it's forcing your body to go through, like, puberty. If you were, born with the correct sex. Do you know what I mean?
Mm-hmm.
So that's kind of, I'm sure and that's, again, another thing that you have to think about, like, with any moodiness you might have. Remember puberty?
Yeah.
Yeah, you're doing it again. You know, that's what this all is. That's what, you know, like, you know, when a girl hits, like, 10, 11, 12 years old, they start to have, like, pain or sensitivity to the nipples, and then the breasts start to get a little bit bigger, and then the hips start to fill out, and the hair starts to change, you know, and that's kind of what you're experiencing now.
Mm-hmm.
You know? So.
Yeah.
All right.
That
so
makes sense.
Estradiol Dalarate. Okay, so we're doing that. And then 20 milligrams intramuscular every 14 days. Okay. Now, okay, I assume you need syringes, right?
Yeah.
And needles, right?
Yeah.
Okay, so do you know what gauges you use to draw it up and what gauges you use to inject?
I do, but I don't.
Okay, it's all right, honey.
Just like try to get the skinniest one.
You're doing great, sweetie. All right, give me 1 second, okay? All right, so this is Biktarvy 30 tablet, 3 refills, and then we'll do estradiol, and that's gonna be 5 mLs. Okay, all right. Okay. Give me 1 second. I'm gonna go get something for you to sign.
All right.
Hello? Don't pull my name. That's not my name.
As soon as I left my phone up, why my dude took me back? That's crazy. Hold on. Not my dude, like the last one, but It's another one that I was messing with. That's too much big. Look, every time I walk in, he be like, hey, sexy, hey, sexy. Why?
Hi, sexy.
What's up?
How are you, baby?
I'm doing good. How you doing? Can I get the organic belly?
The fries?
Yeah. I feel like he gonna ask about my boyfriend. He gonna piss me off with that.